Let's begin here. More than 7,400 children aged below 18 were treated for suicide attempts in just 8 months. The Department of Basic Education released the stats on Monday to mark Teen Suicide Prevention Week, which started on Sunday and ends on the 16th of this month. Let's delve deeper now into what could be some of the causes and what signals are the parents, families, community members possibly missing. We speak to Dr. Nokuthula Mdaka, who is the Gauteng Health Department Psychiatrist responsible for West Rand District, and Dr. Gagu Matsebula, who's a specialist psychiatrist. Good evening to you, and thank you so much for your time. So I'm going to start with you, Nokuthula. When you look at these particular statistics, I mean, these numbers are staggering. We're talking about this a little earlier on this week here on the show as to just how difficult it is to even comprehend, just these numbers and how young people aged below 18 are attempting to take their lives. Let's talk about just what are these numbers telling us?
I think, what we do know is that this period of, teenage years or adolescence is a difficult time. Naturally, it is a difficult time. It is a difficult time in terms of your emotional development, in terms of your physical development, but also the challenges that we see now. I mean, if you think of the rate of substance abuse, the exposure to violence, or the exposure to crime and other traumatic events, we are starting to realize that, children or adolescents in South Africa are really exposed to events that really increase their rate of having mental illnesses. And often, the suicide ideation, which is the idea or the acts of or attempts of suicide, are actually linked to other mental illnesses. So these do reflect that, our teenagers are really struggling emotionally.
Gagu, for you, one would then ask, right, to say that in the past, possibly, maybe we would not be having these conversations publicly. Maybe statistics could have been higher. But is it a now problem, or is it a problem that's always been there? It's just that it was not widely reported.
I think, well, good evening, and thank you for having me and my colleague. I think this is a phenomenon that's been there for quite some time. I think if one looks at it, let's look at HIV for an example. HIV comes about, there's initially a lot of stigma around it, we don't want to speak about it, but then it culminated in multiple public campaigns about HIV and the ease of people speaking about it. And I think mental health in this country and globally indeed is following the same trend. I think the more we're able to speak about it, the more people, and in this case, our kiddies and our teens, the more they're able to come up and say that this is what I'm struggling with. And the more we as society are able to identify that these are the risk factors that predispose our kiddies and teens to mental illnesses, as my colleague has mentioned, as well as thinking about suicide. So I think, in short, it's always been there. And I think the more we can speak about it, the more we can adequately address this phenomenon.
Gagu, let me stay with you before I move back to Nokuthula. So you say that the more we speak about it, the more we can find a way to deal with it. Is that really the nub of the problem, to say that because we're not talking about it, right, we simply aren't, even as parents, being able to at least try find better ways to also engage with our children?
Yes, quite right. As my colleague mentioned when we were starting, that the teenage years are a very difficult time where there's not only emotional development, but there's physical development as well. For our teenagers in particular, their brain is still developing, the frontal part of the brain. And this is the part of the brain that's responsible for things like attention, problem solving, impulsivity, and things like that. And kiddies and teens depend on us as the adults, as the grown-up. They depend on us not only for physical needs like food and security and shelter, but they also depend on us as adults for us to model to them healthier ways of dealing with difficulties and crises. And so I think this discussion behoves us, not just as South Africa, but as the world in general, that maybe we need to start thinking a bit about how do we address difficulties? For an example, how do we come home and speak about a difficult day at work? Do you come home and you're just angry and maybe you start drinking? Or you're able to speak about it in a healthier way to say, my colleague did this to me or my colleague didn't do that. So yes, speaking about it, not only will it highlight the importance of what we're speaking about, but it's also going to maybe give us pause to think about how we interact with each other as society and how we get to interact with our kiddies and teens.
Nokuthula, Gagu is mentioning a very important point, right, to say that how do you come home and, think about it as, as a parent, you're coming home, you've had a difficult day at work, and now you need to face these little people and smile for them and pretend like everything is okay, which is what a lot of parents are likely to do. Does speaking about your difficult day at work make bridging the gap a little bit more easier with your teenagers?
No, definitely. I often reflect to my patients that our kiddies need to start seeing us also struggle emotionally. Take, for example, your own parent dies, right? You often have to hide yourself from your children. They don't see you mourn. They don't see you cry. And when they are later on now older and something like that happens to them, they think that's the right way to mourn. So it's very important for us to reflect these things and to say, these are the challenges I'm having emotionally, right? And start naming your feelings to your children that actually I feel sad today. And, let them ask you, why do you feel sad? And they start to sort of normalize or understand that, it's okay to have emotional challenges. And it also helps to sort of remove the stigma. Because the more we talk about it, the more we normalize it. And they start to see that, okay, so everyone has a bad day and you just need to sit and, sort of talk it out with whoever you trust or whoever you are close to. So the problem is how we behave as adults as well. My colleague mentioned that do we get home and become irritable? Then the kids also learn that this is not a safe space for me to open up. My feelings will not be validated. So definitely it starts with us.
Sure. Something to think about there because, at times parents always want to put up this facade that they've got it all together. And one would think that that is actually what is working. But listening to what you both are saying is that vulnerability is also okay. Nokuthula, I'm going to stay with you. When you then are speaking to some of the young people, let's say if you've had an interaction with those who would have attempted to take their lives, when you have these difficult conversations with them, what are some of the conversations and things they're telling you that would have driven them to that point?
So we do find that sometimes it's just an impulsive response. And I think that also comes from our teens not knowing how to deal with certain situations. So you failed at school and now you're scared that when you go home, your parents are going to shout at you. So we do find that, that it's just an impulsive response to that situation that's happening at that time. But what we are finding is that our teenagers have underlying mental illness. A lot of our teenagers, depression and anxiety, we're picking up a lot of that. So you find that the teenager is coming in with a suicide attempt, or they're presenting to you because of the suicide attempt. But when you dig deep, this is a teenager who's actually been anxious or even depressed since they were in primary school. So we are starting to realize that, and you even see with Department of Education, there's a lot of investment that they are making into really building a stronger psychosocial support within the department so that the kiddies can be picked up very early and they can be supported not only at home but at the schools. Because most of the time, by the time the teen is coming to us, the symptoms are already there.
And I'm going to circle back to that in just a moment. But Gagu, let me come to you. What are you often hearing from some of them?
So I think I'd like to echo what my colleague has said in terms of what the kiddies and teens are going to present with. Another thing that we see happening quite a lot is bullying. A lot of kiddies and teens are really struggling with bullying. And there is some research that has been done that has shown that there seems to be this particular nastiness that is emerging in these latter days that we live in, particularly after COVID. Bullying is no longer a kid maybe making fun of you on the playground, but there's the actual threat of death, there's a threat of physical harm, there's a threat of violence, and this is a form of bullying at times that doesn't even end. I mean, kiddies and teens have got access to cell phone and social media, and you find that that's where they get ostracized. So that's the one thing that we see. The other thing that they do mention, and my colleague did mention this a few minutes earlier, is that aggression, physical violence, not feeling safe, the usage of substances, all of these, not only are they risk factors that predispose our kiddies and teens to depression, anxiety, and thinking about death, but they also push them towards trying to hurt themselves with the goal of ending their lives.
Gagu,
that is why it is, yes.
Pardon me, how big of an issue is social media? I don't want us to lose that point.
It is an absolutely essential part. It is very important. It is for that particular reason that certain countries like Australia, for an example, are starting to come out with policies to say maybe kiddies less than the age of 16 should not be on social media. And that simply is because their brains are still developing, and they see their other, peers, and it seems as if the peer has got it all together. They've got a nice big house, they've got access to nice clothes, and their parents drive really expensive cars. And to a kiddie that's still growing, who is yet to understand that media or social media has content that is extremely curated, to them, they start to feel bad. Self-esteem starts to take a knock, unhealthy thinking starts to creep in, and then they begin to think about death because they're thinking, what's the point? And I think it's really important for us to remember that kiddies and teens are not just small adults. These are people who are still developing, who are yet to learn that this is how life is and this is how life is not meant to be. And so social media can play quite an adverse part in their mental health.
And it does sound like it's an SOS that parents need to look closely at. Nokuthula, when you then are looking at all of this, right? So when you think about healthcare workers, you are the first responders when it comes to seeing these children and having to speak to a number of them. And I wonder, because yes, you may be first responders trained in doing that, but how much of a strain does this put on resources and at the same time on yourselves as healthcare workers when you're seeing them in these large numbers?
I mean, definitely there's a huge strain on the physical resources. But I think it's difficult as a psychiatrist, as a psychologist, or anyone who is exposed to these children. I mean, I don't even just want to look at it in terms of healthcare workers. I'm just thinking about the teachers. I've had a few incidents where the teen or the child actually attempted suicide at school. So I think the impact of even hearing of a 9-year-old who attempted suicide or who became successful and actually passed away, because we are actually getting teenagers who are passing away. This is not just seeking attention, that exposure, hearing that is traumatic. And as a healthcare worker, there could be blame, most of us are also parents. We might be psychiatrists, but we are parents as well. And you start to wonder, even personally, how are my kids doing? And what did these parents, sort of miss that I may also be missing? And there's a lot of guilt that you take as a healthcare worker when your patient attempts suicide or even becomes successful and passes away. So it does definitely cause an emotional and physical strain on the healthcare workers as individuals, but also definitely on the system, particularly because we do have a shortage of psychiatric or psychosocial services that are available for teenagers or adolescents, in fact, children and adolescents. So very often you can even be stuck with this child and not knowing where to admit them or not knowing where to actually send them for help. So this does actually call for not just the public sector, but just the healthcare sector to really start looking into providing services. And I think prevention for me is core. What are we doing at the preschools? What are we doing at the primary schools before we actually have teenagers? What are we even doing with the couple that's planning to have a child in terms of parental skills?
Yeah.
So I think we mustn't just look at the problem now. Yes, we must respond to what we are seeing, but we need to really go back to prevention.
Sure, prevention is quite critical. So in about 30 seconds each then, I wonder what becomes your parting shot to parents when it comes to how do they begin to also try and ease up the pressure somewhat in the home. I'm going to start with you, Gagu.
So thank you for that. I think for me, it's something that I've summarized as the 2 I's: interaction and interest. Interaction is the kiddie or teen still interacting with their family and friends the way we know them to. And the second I, interest. Are they still displaying interest in things that they used to previously? Are they still playing sports? Are they performing well in terms of their academics? We need to know our kiddies and our teens, and we need, as adults and as society in general, to learn to model healthier behavior to our kiddies and teens.
Healthier behavior indeed, and I hope one day we even have a conversation about how do we begin to model this healthier behavior, because sometimes people think what's toxic is actually healthy and it's not helping. Nokuthula, for you, what becomes, your parting shot for parents?
I think my colleague has already mentioned this. I think really as parents, let's start supervising the exposure to social media. It doesn't only create unnecessary pressure, but also they are getting the ideas of how to actually attempt. There's a lot of dangerous content on social media. And let's remember that these kiddies, their brains are not ready to make such decisions. The brains are not ready to actually filter out what content is good and what content is bad.
Thank you so much for your time to both of you, and certainly this does go a long way towards speaking to some of the parents out there and addressing some of the concerns. Appreciate your time this evening. That was Dr. Nokuthula Mdaka, who's the Gauteng Health Department Psychiatrist responsible for West Rand District, and Dr. Gagu Matsebula, who's a specialist psychiatrist.